Is there anything new on the stem cell front and any new information from Duke retaining to the new study that they just did?
We don't have the details. It looks like Duke did 3 small studies that all finished up at the same time in February of this year. We're supposed to have the data sometime in the summer this year. So, I mean, any day now. I checked, the website and the med publications, and nothing has been published yet. But I would suspect it would be pretty soon. And then they're actively recruiting now for an adult study. Young adults from 18 to 26, I believe. It might be 18 to 25 with autism, because it's only really been looked at in younger children. And the question is, can young adults benefit? And my thought is that they will benefit, because brain inflammation is brain inflammation. It doesn't change just because you're younger. It might be easier to treat when you're younger, but it doesn't really change. So we'll see what that shows as well.
As a parent, both of us, we've seen tremendous growth in our children. What do you tell parents who are concerned about their children's futures when it comes down to autism, and how to approach treatments that like their doctors may not be 100% on board with stem cell therapy and treatment? How do you speak to that?
Well, at some point, everything that's new, was ridiculed and put down as kind of crazy. And certainly not everything new is good, but everything that's good was once new, And as of right now, kind of standard treatment, whether it's therapy or supplements, there's not really any great science behind that. There's no big studies that show these supplements, help. However, with umbilical cord blood therapy and stem cell therapy, we have experimental animal models, both rodent and primate, that shows that they get better with this. We're starting to understand the physiology. We're starting to see that there's one particular cell called the glial cell, which is a support cell for neurons, and that they have the ability to push new connections, to bring, neural stem cells, into order to drive new growth in the brain. And we know that these cells have the ability to turn that on, something called brain-derived neurotrophic factor. And obviously that's never with some type of supplement or even with therapy. And don't get me wrong, I think therapy is good. And with time and therapy, I do think there's benefit. But I do believe you have to be able to lift 20 pounds before you can lift 100 pounds. And if you can start getting the brain to normalize and get more connections, then you can make therapy work even better. How you speak to a doctor is very difficult. Some of the doctors are stuck in their ways. I've that just would listen to their doctor, and I've had doctors bring their patients in, or their children in, and they're doing it just because their wives want to do it, and then call me and say, we've never seen any growth like we've seen now. And certainly if anybody contacts you to contact me, I can send them some papers, and send them directly to their doctors. They just go, here's 5 papers that show why this should be beneficial.
Cool. I've been asked, is this a cure? I know it's not. It's not. How do you speak to that specific statement?
Say the statement again.
Is this a cure for autism? Is
it a cure? Well, obviously this is in its infancy. So neuroinflammation can be ongoing. Think of chronic traumatic encephalopathy in these athletes that get, multiple subconcussive blows. So every time you get hit, it's a new pattern for the inflammation. So since we don't know the root cause of the inflammation, every time it happens again, inflammation starts, up again. However, we know that one dose seems to help significantly. And we know that looking at inflammation through the spinal fluid is possible. So I think pretty soon somebody's going to come up with a study where you give a dose, you look at the inflammatory markers in the spinal fluid, and are they up or are they down? If they're down but still present, you give another dose, and then you check again. Is it up or is it down? If it's even lower, and you keep doing that until you can drive the inflammatory marker down. And this was somewhat just done in an Alzheimer's study out of UCLA, where they gave a product from mesenchymal stem cells harvested from bone marrow, and they gave it to these people with Alzheimer's. And not only did they see their CTs and their MRIs getting better, the pathology starting to go the way, the amyloid deposition, the neurofibrillary tangles start to go away, but the inflammatory markers that are known for Alzheimer's all decreased. They didn't go away, but they got cut by like 30% with just a single dose. So, the question is, what if you give a second dose? What if you give a third dose? That study did not show a benefit as in the dementia, like the dementia didn't get better, but certainly, the MRIs got better and the inflammatory markers get better, but maybe they just have to drive the inflammation down even lower, or they were giving it to people who were moderate to severe and they need to treat, before it gets that far, before they've lost too many brain cells. So I'm not here to tell you it's a cure, but I'm telling you that, it can make a huge difference. And as long as your child's not neurotypical, it would make sense to give it again until you see no benefit. And that's kind of, in my son's, case study, it took about 3 doses and he was completely conversant, following commands, no aberrant behaviors, good in social situations. And he lives on his own now, drives a car, and has a job. I have continued some because he has some cognitive issues, because these cells have been shown to grow new brain cells, and he has a small brain. He lost brain cells with his injury when he was born, and so I give it for that. But from the kind of the classic autism symptoms, you wouldn't call him autistic anymore.
I remember we talked a little bit about that with Larson's brain injury when he was a child. So yeah, no, that makes perfect sense. So whenever you are looking at taking on a new patient, what are some of the key factors you look for when deciding if a child or adult would be a good candidate for stem cell treatment?
That's a very good question. We know that about 30 to 40% of people don't benefit. And so it's always nice to try to find the 60 or 70% who will benefit. When Duke looked at their study, especially their phase 2 study, the only thing they saw is, as a group, people with IQs below 70, 69 and below, did not benefit as a group. However, there were some people with IQs in that range that still benefited, but not as a group, whereas people 70 and above did benefit as a group. So I ask about IQ testing. The problem with IQ testing is our children, if they decide not to take an IQ test, there's no way you can get them to take it. So I'm, more apt to ask, are they potty trained? Do they dress themselves? Do they help you dress themselves? Can they follow a command? If there's something that they want to communicate, will they lead you by hand there? Do they have a device they communicate on? Kind of real world things of intelligence. The second thing I ask is, was there a period when you thought everything was going well? Were they hitting their milestones? They were starting to babble. They were starting to talk. They had a few words, and then they regressed. Because if they were doing well and then they regressed, that means something happened to cause them to regress. And that points to an inflammatory, problem as well. And obviously a lot of people talk about that 18-month kind of window when they get, all those vaccines. And, a lot of majorities say, my kid had a high fever, he ended up in the hospital, he was different. And it's hard to say that because you're trying to do something positive for your child. But I hear that time and time again. I like to hear, I had COVID in the first trimester, and he came out and he missed all his milestones. I had a woman, today who got COVID, and she was pretty sick. In fact, they thought she was going to miscarry. She got blood clots in her uterus, blood clots in her placenta. The fetus's heart rate went up too high, but then everything settled down, and the child was born. But now the child has a diagnosis of autism. And so we know clearly through animal studies and through epidemiologic data that if that happens to women, they pass inflammation on to their children. So he's a good candidate because we know he had an inflammatory, hit. In all the studies, they tried to exclude people with known genetic abnormalities, Fragile X syndrome, XYY, Rett syndrome, things like that. So if they had that, I probably would, I would tell them, I said, we don't know if it would benefit or not, but what we know is they've been excluded from the study. Nobody's done studies on kids with known genetic abnormalities. So I try to offer hope. I try to say this stuff's incredibly safe. There's no long-term side effects. So if it's something you want to do, I'm willing to do it. But I try to give them, the best and try not to sugarcoat it. You're not talking to a salesman. You're talking to a physician. And I try to lay out the pros and cons and then help them make a decision.
So obviously we know the pros. What are the cons of stem cell therapy? Are there any? Because I haven't seen any. Other just like the first day, she was a little more aggressive.
Correct.
Yeah.
The short-term side effects we can see with almost any type of immunologic agent, rash and a fever, usually within the first 6 hours. But that's only in about 3 to 4% of people. We now pre-treat with Benadryl and give a little bit of hydrocortisone, IV, and that tends to knock that out. So, if you do get a rash or get a low-grade fever, we just treat that with Tylenol or Benadryl, and that's usually within the first 6 hours. Certainly, increase in aggressive behavior and increase of hyperactive behavior has been described, but mostly described in kids that have aggressive or hyperactive behavior. But these were episodic, they were not continuous, and by a couple of weeks, they were all gone. So they've returned to baseline. So, by the very nature, these cells don't become engraft. They work, they go away. That's why the benefit tends to kind of plateau at 6 months. So these cells don't live long-term in the body. They do their job and then they leave. And there's really no long-term side effects that have ever been shown.
Cool. Okay, last two questions are kind of around autism, but they're more talking to neurodivergent disorders. And what makes autism react differently from other neurodivergent orders? Disorders. Is there a difference in how the stem cells react to autism versus, say, CP?
Well, the answer to that is probably not. Neurodivergent is, kind of a nice word for some type of brain injury. We want to say, okay, this child has autism. We have to embrace the way he thinks, doesn't talk, acts, etc. And you should give empathy to anybody, with autism. But now, as we're starting to understand, there's a fundamental inflammatory process in the brain that we may be able to impact. Cerebral palsy is a neuroinflammatory disorder. Most people don't know that. Duke did a cerebral palsy study before they did an autism study. 88% of the kids with cerebral palsy got better. So Duke has ongoing cerebral palsy studies as well. But if you look at the big neurodegenerative disorders, autism, cerebral palsy, Alzheimer's, multiple sclerosis, Lou Gehrig's disease, chronic traumatic encephalopathy, traumatic brain injury, Parkinson's disease, all those are neuroinflammatorily based. And so we now have studies that looks like it's going to help at Alzheimer's, MS, Parkinson's disease, chronic traumatic encephalopathy, cerebral palsy, autism. So it can help that in traumatic brain injury, which a lot of people after a traumatic brain injury or even a stroke develop inflammation. So that's one thing. Now, those are kind of neurodegenerative disorders. If you look at kind of what gets lumped into neurodivergent disorders, then you have obsessive compulsive disease, you have ADD, ADHD. And right now, we don't have autopsy studies, on those children. We have, medications and drugs, to treat those. But we do see kids with kind of aberrant behaviors that it do have autism. Their behaviors get better. They start to sleep better. Their ADD gets better. I think one day, we may say, okay, let's take a group of kids with severe ADD or ADHD. Let's do spinal taps on them and let's see if they have evidence of neuroinflammation. But right now, there's not a big call to arms because of it's manageable with medication and psychology. But I think it may be a spectrum, because certainly when you look at autism, ADD and ADHD, obsessive compulsive disease, goes hand in hand with those.
And so that was actually my last question. Children with ADHD, sensory processing disorder, things that are not normally in the neuroinflammatory world. Could we see improvement in those behaviors because of the healing capacity of the stem cells?
Right. It would be hard for me to say, let's do it, because I try to practice evidence-based medicine, and there's no evidence it's a neuroinflammatory issue. However, it could be. It would just take somebody studying it. And right now, nobody is looking for a significant, neuroinflammatory issue. Duke is trying to work on a non-invasive way to measure neuroinflammation, because if there's a scan that they can do that goes, oh yeah, you have brain inflammation, then that starts to drive people to therapy or no therapy, because that might be the reason why 30 to 40% of people don't benefit, is because they have another mechanism leading to their speech-related issues, socialization, and aberrant behaviors. They just get lumped in because it is autism spectrum disorder. So if you have delayed speech, repetitive behaviors, and poor socialization, you get laid in there, even though it may be a genetic abnormality, that type of deal. Even though a genetic abnormality may predispose you to neuroinflammation. That's another thing we don't know.
Last question. And this literally just came to me today. So if someone, and you kind of alluded to it earlier, if someone receives treatment, they're from you or any other provider that does this, but I don't know you, and they want to discontinue their ABA therapy or their regular, their regular therapies, is that a good idea, bad idea?
I think it's a bad idea, just because, if you think of a developing brain, a 1-year-old or a 2-year-old, it gets developed. There's a clear, you creep before you crawl before you walk before you run, you babble before you talk, you say words before you say sentences, and you say sentences before you become, conversant. And so if you think that we've now gotten in the brain into a real lump of clay that now it can start making connections, then you want to be intentional about making those connections. Now, can it happen at home? Certainly it can happen at home. I'm not saying there's anything special about the therapy, because most kids don't ever go to therapy. But I do think it becomes intentional, especially if you're a school age and you're getting it at school. And those speech therapists and occupational therapists and the behavioral therapists have been taught on ways to build brain connections. It's not that moms don't do it and that that kids don't pattern after siblings, because that's the way 99% of the world is. Uh, However, I think it would be nice to be intentional. Plus, these people are also, drawing graphs and showing you improvements, and they can also point out areas of deficits. Like, if you're doing occupational and it just turns out that the big stuff has gotten better, but now we need fine motor skill stuff. Then all of a sudden they have them picking up coins and putting needles through buttons. They can work on things like that.
Anything else that you feel like we need to say?
No, I think it's amazing. I know how difficult it is to be a parent of an autistic child. I've done it. I talk to these parents and it breaks your heart, but when you start to hear success stories, it makes you feel warm all over. My hope in my lifetime is we say this is the reason, and before I die, it's 1 in 10,000 again, and we have a treatment for that one kid. And I think that's realistic, to be honest, because we're really starting to figure things out. And Bernie Marcus has donated a lot of money for stem cells. He's one of the founders of Home Depot, and he is leading the charge through Duke as well as other programs.